The goal of doing electrodiagnostic study mainly localization of lesion and to assess severity of involvement, localization, muscle, proximal, distal, generalized, craniobulbar, nerve fiber type involved, sensory, motor, mixed, sight, neuronopathy, radiculopathy, plexopathy, demyelinating axonopathy or both, temporal, course, acute, chronic, acute and chronic, NMJ, presynaptic, postsynaptic, and severity. Electrodiagnostic study NCS, EMG, late response F-wave and reflex, repetitive nerve stimulation, evoked potential, somatosensory evoked potential, auditory evoked potential, visual evoked potential, and brainstem evoked potential. Indication: primary muscle disease, sensory abnormality, nerve injuries, entrapment, plexus injury, radiculopathy, and UMN. Nerve conduction study, physiological study of conduction parameter, motor or sensory. Motor nerve conduction study is done first. Easy to get response than sensory. Active electrode referred to as G1 placed over the belly of the muscle, and reference electrode referred to as G2 placed over the tendon of muscle supplied by the nerve in question. Ground electrode is placed between the stimulating and active electrode to reduce the interference from the machine, ambient surrounding, and patient. Stimulation is done at specific point along the course of the nerve with the cathode near the electrode. Stimulation is done at specific point along the course of the nerve. Biphasic compound muscle action potential Cmap obtained from the active electrode is displayed on the screen. Stimulus is raised to a point where it does not increase the amplitude of Cmap anymore. That is supramaximal stimulation. Supramaximal stimulation is important as we must ensure all the motor units are stimulated. Once the Cmap is obtained, the amplitude, latency are measured and compared with accepted normal values or with the values from the opposite limb. Latency is the time taken for nerve conduction from point of stimulation to the active electrode. The conduction by the fastest conducting fiber. It is measured in milliseconds in case of motor nerve conduction study. Latency, time taken for nerve conduction in case of motor nerve conduction study. The latency includes conduction time from point of stimulation to the NMJ, the time delay across the NMJ and the muscle depolarization time. Time delay across the NMJ and muscle depolarization time, and stimulation is done at different points along the course of nerve and segmental velocity is measured. Stimulation is done at different points along the course of nerve and segmental velocity is measured. For example, median nerve is stimulated at rest distally and elbow proximally, and time taken to conduct along the segment is